Hello students, welcome to another episode of Kawatra's ENT classroom, and today I am going to talk briefly about the instruments that are used in the ear surgeries. And this episode is especially for those undergraduate students who are going to give their practical exams. And I'll be discussing only the instruments, not the operations. So let's get started. So first instrument is this Hartmann's oral speculum. So if you see carefully, and you can compare, these are all oral speculums, but this instrument, Hartmann's oral speculum, it's black in color, funnel shaped, and used for routine ENT examination to examine the tympanic membrane for OPD evaluation. So mainly, okay, and it can also be used for foreign body removals and wax removal in cases where the external auditory canal is not wide enough. So it also helps in visualization as well as straightening of the cartilaginous part of the external auditory canal, and it widens the external auditory canal, especially the cartilaginous part, so that you get a better visualization, and the color black prevents the reflection. तो मेरे ख्याल से आप समझ गए होंगे, इसका नाम है हार्टमन्स ओरल स्पेकुलम, और इसका इस्तेमाल जो है कान के अंदर टिम्पैनिक मेम्ब्रेन को देखने के लिए होता है, फॉरेन बॉडी रिमूवल्स, वैक्स रिमूवल के लिए होता है, ठीक है, और इसकी मदद से आप कान सीधा करके अच्छे से कान के अंदर देख सकते हैं. हाँ, दूसरा ये ईयर ओरल स्पेकुलम, इसका नाम है, आप बताइए, इट इज़ कॉल्ड एज रोजन्स स्लॉटेड oral speculum. So if you can see, this is partially slotted and partially complete. This speculum is specially used in ear surgeries, especially for infiltration of the external auditory canal before the ear surgery begins, and it can also be used while doing the ear surgeries when you are wanting to elevate the tympanomeatal flap. Okay, so this is Tomarken's this is the Rosen's slotted ear speculum, and third is this Tomarken's slotted ear speculum. Now this is, if you can compare, this is partially slotted and this is completely slotted. So Tomarken is total, T for Tomarken and T for total. Alright, a good way to remember, just a tip for you. And the advantage is that आपको इसमें पूरा अंदर तक इन्फिल्ट्रेशन, जब आप कान की सर्जरी में कर रहे हैं एक्सटर्नल ऑडिटरी कैनाल में, तो आपको पूरा अंदर तक टिम्पैनिक मेम्ब्रेन तक विजुलाइजेशन होता है, और आप आराम से अपना लोकल एनेस्थीसिया इन्फिल्ट्रेट कर सकते हैं एक्सटर्नल ऑडिटरी कैनाल में, और अपने फाइन इंस्ट्रूमेंट्स जो हैं सर्जरी में वो भी आप इस्तेमाल कर सकते हैं अगर आपको सर्जरी करनी है, स्पेशली वेयर वी आर डूइंग परमिएटल टिम्पैनोप्लास्टी और वी आर डूइंग अ स्टेपिडोटमी सर्जरी. सो दीज आर दी वेरियस यूजेस ऑफ दीज ईयर स्पेकुलम. डिफरेंस आपको ये बताना है, ये जनरली ओपीडी पर्पस के लिए यूज़ होता है और ये सर्जिकल पर्पसेस के लिए यूज़ होते हैं. राइट, एक बार नाम मैं फिर से रिपीट कर रहा हूँ, ये हार्टमैन है, ये रोजन है, और ये टोमार्कन है. टी फॉर टोटल, टी फॉर टोमार्कन. और एक ये और सेल्फ रिटेनिंग ओरल स्पेकुलम विच इज़ कॉल्ड एज होमग्रेन्स सेल्फ रिटेनिंग ओरल स्पेकुलम. इसमें ये एक स्लॉट होता है जिसको आप दबाने से, ये स्क्रू है, इसको आप जब दबाते हैं तो ये एरिया आगे का खुल जाता है, तो यू गेट अ वाइडर व्यू and it dilates the external auditory canal and specially used for doing permeated tympanoplasty, and you can use both your instruments once this is put in place. So you don't need to have any other, you don't need to hold the instrument, so both your hands can be free. And it is specially used for doing tympanoplasty or staphylotomy when you are doing it through the permeatal approach or the endoral approach, right? So ये आपके ईयर स्पेकुलम्स हो गए, इनको आपको पहचानना होगा कि कौन सा है, उसका नाम बताना है, उसका यूज़ जो मैं आपको बता चुका हूँ, एग्जामिनेशन ऑफ ईयर, tympanic membrane, external auditory canal, the inner part of the external auditory canal, and for helping in removal of wax, foreign body in the ear, and for surgeries of the ear like laryngoplasty, tympanoplasty and mastoidectomy and middle ear reconstruction surgeries, right? अगला इंस्ट्रूमेंट ये, दिस इज अगेन एन इम्पॉर्टेंट इंस्ट्रूमेंट, और ये कान के अलावा भी कुछ जगहों पे यूज़ होता है और कॉमनली पूछा भी जाता है. इसका नाम है मॉलिसन्स सेल्फ रिटेनिंग मैस्टॉइड वूंड रिट्रैक्टर. तो जैसे कि आप देख सकते हैं, दिस इंस्ट्रूमेंट हैज़ गॉट अ लॉक ratchet, and this is the handle where you retract it, and these are the prongs. This is a 3-prong one. So if this is the incision, especially for ear surgeries in the post-oral approach of Wild, you give an incision at the back of the ear, right? In the post-oral incision when you give, which is about 0.5 to 1 centimeters behind the post-oral groove. After, supposing this is the incision, and after giving the incision, you retract it, the area, and this locks. So you get a space here to work on the post-oral area. So this instrument is used for helping in harvesting the temporalis fascia, or during other mastoid surgeries or tympanoplasty surgery, and it is a hemostatic retractor. Why is it called hemostatic? Because when you retract, the prongs give pressure on the skin and the subcutaneous tissue area, thereby compressing the superficial vasculature, and all these blood vessels get pressed and the bleeding stops. So you get a good field of visualization, and you can operate in this site which is being opened up. Okay, so this is called as Mollison's self-retaining mastoid wound retractor. Okay, this is the lock, this is the handle, and this is the prong. Okay, and this is the blade area. Okay, the other uses of this instrument, it can also be used in Cardwell leg surgery, where you are doing a sublabial incision, you need to open up that area. You can use it in anterior ethmoidectomy, जब आप incision यहाँ देके इसको खोलते हैं. Lateral rhinotomy operations में भी ये यूज होता है, और ये आपके larynx के ऑपरेशन जिसमें laryngofissure सर्जरी है या ट्रेकियोस्मी सर्जरी है, उसमें भी ये फ्लैप को रिट्रैक्ट करने के लिए यूज होता है. सो बेसिकली इट इज़ अ हीमोस्टैटिक रिट्रैक्टर फॉर रिट्रैक्टिंग दी फ्लैप्स which you have created after incising the skin and the subcutaneous tissue. And the prongs, by giving pressure, helps in achieving the hemostasis. All right. तो ये अब आप इसको याद रखिएगा, Mollison's self-retaining mastoid wound retractor. Okay. The next instrument which is important is this Farabouf's Periosteal Elevator. So this instrument is basically used by holding this handle, and this is the thumb press area, and this is the area which elevates the, this is sharp, if you can see, it elevates the periosteum. So where we need to elevate the periosteum is in mastoid surgeries. Okay, so this is a sharp elevator. It has to be held like this. You can't hold it like this, or you can't hold it like this. You have to hold it like this, you have to angulate it to the periosteum and then gradually push it to elevate the periosteum. You have to scrape off the periosteum from the mastoid bone before you start drilling. So this is called as periosteal elevator, and the name of the instrument is Farabauf's periosteal elevator. This instrument can be used in other places also where you want to elevate the periosteum. So likewise also in cardiac neck surgeries or anterior ethmoidectomy surgery, or you can use it in mandibulectomy surgery where you want to elevate the periosteum and then cut the drill or open up the bone. Okay, so this is also a multi-use instrument. So wherever you want to elevate the periosteum, you have to use this instrument. It's a very useful instrument. Then another instrument which is used in ear surgery is this house graft press or the graft spreader. So if you can see, it has got two thin plates where you place your harvested temporalis fascia or your vein graft or the perichondrial graft that you keep. You place it here and you lock it, and within this the graft will spread out and become thinned out, and you keep it aside till you use it during the tympanoplasty surgery or laryngoplasty surgery. So this instrument is called as the house graft spreader or the graft press. It's a simple instrument, but it is a very useful instrument to shape and to spread out your harvested temporalis fascia or the perichondrial fascia used for grafting of the perforated tympanic membrane. Okay, this instrument is called as the Pulitzer myringotomy knife. So if you see, it's an angulated instrument और ये हार्पून की तरह होता है. आप इसको देखेंगे, ये शार्प स्टैब इंसिजन टिम्पैनिक मेम्ब्रेन में देने के लिए काम आता है. जब आप मैरिंगोटमी सर्जरी करते हैं, मैरिंगोटमी इज़ इंडिकेटेड फॉर secretory otitis media or नॉन रिस्पॉन्डिंग acute otitis media, जहाँ पर मिडल ईयर में फ्लूइड इकट्ठा हो जाता है और वो ड्रेन नहीं हो रहा बिकॉज ऑफ द यूस्टेशियन ट्यूब ब्लॉकेज. सो व्हाट यू डू इज यू localize, straighten the ear canal with the ear speculum and visualize your tympanic membrane under the microscope, and in the antero-inferior quadrant you give a stab incision with this myringotomy knife, which is called as the Pulitzer's myringotomy knife. Angulation इसीलिए है क्योंकि ये कान के अंदर बिना आपकी विजुलाइजेशन को ऑब्स्ट्रक्ट किए हुए अंदर चला जाता है, जैसे आप देख पा रहे हैं इसको. ठीक है, ये बिल्कुल सीधा अंदर इसके साथ सटा हुआ चला जाएगा और आप स्टैब इंसिजन दे के फिर आप माइक्रो सक्शन से अपने सिक्रीशंस उसको निकाल सकते हैं, एंड देन यू कैन पुट अ ग्रोमेट इफ यू नीड टू. ऑलराइट, सो this was your myringotomy knife called Pulitzer's myringotomy knife. Okay, other useful instruments are these three sets of instrument which are all curates. Curates को पहचानने का तरीका ये है कि वो बिल्कुल आइसक्रीम स्कूप की तरह होते हैं और ये generally it is used for removing small chips of bone and diseased mucosa while doing various ear surgeries like stapes surgery or mastoidectomy surgery or tympanoplasty surgery. So they break the septa and they exteriorize these mastoid air cells and they remove the diseased mucosa as well as the chips of bone. And the first curate I would talk about is this house microcurrent. Okay, so if you can see, these are small scoop like things, and you have to remove the scutum or other middle ear spicules which are there, or diseased mucosa. You use it like a pen to scoop out the diseased bony spicules or septa. All these you can scrape out. So it's basically a scraping instrument, but it is controlled scraping of the bone. So it can only take out small chips of bone, not large. So it's a safe and a good and handy instrument. This is your Lampert's curate. This is a little more sturdy instrument. It has to be used for larger scoops. If you need to use it like this, you have to hold it like this. Okay, the method of holding it is in this manner. Okay, so it's like you have to screw it a little bit. If this is the scutum area, you take it out and you remove it. So scutum is the upper lateral most part of the middle ear. So it is the external auditory canal का जो बिल्कुल superior most end होता है, उसको scutum कहते हैं, जिसके पीछे आपका Prusac space होती है, where the cholestoma starts forming after forming a retraction pocket. So that part you remove with this. Okay, or you can, even in the mastoid surgery, when you are trying to open up and seek your mastoid antrum, you can use this instrument deep down to explore the antrum. And this is another instrument which is called as the McEwens curate and the Cellseeker. This instrument is also used in mastoidectomy surgeries when you are doing cortical mastoidectomy or canal wall down mastoidectomy. This end is the Cellseeker. So when you are trying to seek the various cells, diseased hair cells, you probe and visualize whether it is a cell or is it something else, and you have to localize your first biggest cell that you have to open is the mastoid antrum. So it is a very useful instrument to localizing the additus ad antrum when you are going deep. And as you go deep, you localize it, you move, and then you use the curate to curate out the diseased hair cell. So these are the various important instruments that are there while doing surgery. And another instrument that I would like to bring in, which has been introduced and very commonly done in the ear surgeries, is this Micromotor drill, which has got various attachments to it. So this is the console, and which has got a foot switch attached to it from the back, which is there on your foot. When you press it, this thing gets on, and this is the micromotor handpiece, micromotor itself, and this is the handpiece which you attach on the micromotor, and this is your cutting burr, alright, which you put it here, and you lock it properly, and you hold your drill. And with this foot switch, every time you press, the drill will go clockwise or counterclockwise, and it will rotate, and you can then burr hole the mastoid bone and remove the bone. So this is the new advent, and this was the old one, because before that, before the drill, people used to use hammer and gouge and the curates. So curates are still used, but mainly for the finer work into the middle ear or into the mastoid. But the major drilling of the bone is with this instrument, which is called as the Micromotor drill. Okay, so this has got the console. Parts are console, the foot switch, the micromotor, the handpiece, and the burr bit. Okay. So this brings to an end the basic instruments which will be asked from you people, and I hope you will be able to answer them now, and wish you all the best for the exams, and I hope that you do well. Okay, thank you very much.